project was a project that was implemented between 2019 and early 2020 in 4 countries in Africa. That is Uganda, Kenya, Malawi, and Zimbabwe. And the main goal of this project was really to build advocacy capability for youth-led organizations within the region to be able to advocate for sexual reproductive health and rights and ending teenage pregnancy. This is something that the 4 organizations that were implementing this project under the She Decides Alliance, which are Uganda Youth and Adolescents Health Forum in Uganda, who was coordinating the project. We had My Age Trust in Zimbabwe. We had Her Liberty in Malawi and Organization of African Youth in Kenya. So for Uganda, we had a good number of assessments that were carried out. Specifically, we were focusing on Mbale district as a key area with high indicators, high adolescent health indicators, specifically looking at teenage pregnancy, but then also access to sexual reproductive health services and youth-friendly services at the different health facilities.
We conducted an assessment where we assessed, we tried to assess young people's experiences, challenges, and opportunities in regard to demand, access, availability, but also uptake of youth-friendly services in different health facilities. I had an opportunity to interact with healthcare providers to also tell us what specific challenges they face when they are providing healthcare services to young people. And it's not surprising that some of the things that came out, for example, like health worker biases, the negative biases around providing, say, family planning services to adolescents because of the law, and that's where the issue of age of consent comes up, because healthcare providers are biased to say, because the law says when you're below 18, you're a child, and you need consent from your parents to access, say, a family planning service. But then these young people are having sex, but they don't want to tell their parents that they're having sex. And we're able to launch this report at the district in Mbale, but also at the national level. Findings of the research have informed key actions like, for example, the formulation of the Adolescent Health Technical Working Group at the district level. And today we have very many young people who are able to participate in policy and decision-making at the subnational level.
Also importantly, we built a network of youth-led organizations in order to be able to build their capacity.
UYAHF came up with an idea to see that we come up with the Eastern Youth Network on Sexual and Reproductive Health. So for example, here in Tororo, we are a network of about 5 organizations that work hand in hand. And this was all because of UYAHF. Before, we were not really working together. We didn't know what other CSOs were doing. But after we had this mapping exercise done, we were able to integrate our organizational programs, which we were able to merge with other organizations. And it also gave us an opportunity to learn a lot from UYAHF, because there are things, for example, when it comes to policies, those are mainly the key areas that we actually learned from UYAHF. When it came to policies, especially on sexual and reproductive health, when it came to teenage pregnancies, when we talk about national school health policy. So we're able to work generally together and integrate most of our services.
We had various trainings where we were able to build capacities of over 100 youth-led organizations within the region. And the capacity was being built in advocacy as well as research and communication. And we were able to send out these champions or youth-led organizations to then go out and carry out research on the different kind of issues that we face within the 4 countries. In Mbale district, it was a very, very monumental activity because it was the report was able to be taken up by the district and has informed a lot of policy change at the district level. They've been able to take some of the recommendations that were made. Some health facilities that did not have youth-friendly corners are already considering alternatives towards making their spaces more youth-friendly.
So we are blessed as a district to have UYAHF on board, and we are going to support them to work with us and bring other partners on board.
We have a digital map that places each and every organization across the region. So the benefit of this as a youth-led organization is we are able to have our donors, various donors, international donors, be able to go to our digital map and get information about youth-led organizations. As youth-led organizations, we rarely have a face, so this digital map allows donors to know what it is that we are doing, where we are located, and how easy it is to be able to work with that. We had a very active social media page. It's still active, up to date, which is a good thing. And it's just basically continually showing what is it that young people are doing, that adolescent girls are doing, in order to bring change to these issues.
It has been an activity, I believe, as an advocate for young people. We are able to compare. We are able to see the activities that are being promoted in another district and perhaps copy.
We have the SUWI helpline. Different youths call and then they inquire for support in case they have undergone a sexual gender-based violence, for instance a rape case. They inquire how should I go about it, and they are managed on time.
We were able to mobilize voices of young people to meaningfully participate, shape and inform Uganda's commitments to the ICPD Plus 25, where we also compiled these voices of young people into a youth ICPD position paper that we presented to the National Population Council and the ICPD Task Force. And today we are glad that Ministry of Education is pushing for the passing of a school health policy. Ministry of Health is pushing for the approval of the National Adolescent Health Policy, and the project has also been able to gather a mass of young people to put pressure on government and hold policymakers accountable to these policies.
On top of that, we had various community activities, because it's very important that if we are going to address issues to do with teenage pregnancy and child marriage, we also get to deal with the cultural norms on ground. So we had activities that looked at the entire socio-ecological model, activities that reached out to the girls themselves, issues to do with young mothers forums, how is it that we can reach already pregnant adolescent girls in order to prevent them from having another unplanned for pregnancy, but then also how is it that we can reach these vulnerable adolescent girls with correct information in order to ensure that they do not get pregnant themselves.
We are encouraging the youth to go to the center to get advice, mainly those ones who are having unplanned pregnancies, also helping those ones who are not yet pregnant to access ways of protecting themselves from getting STIs, and also reducing issues of teenage pregnancy.
From these Young Mothers Forums, we are forming what we call Young Mothers Clubs. You need a place where you can find other girls who are just like you, where you can get correct information.
With this Young Mothers Forum, we have had an opportunity for young people to come together, to come and share and have all their questions answered, and the leadership they have provided within themselves has really helped them to discover a lot and to know where to go, to know how to report issues that happen to them. I believe with the UYAHF intervention, Butaleja is out to utilize her young population in the best way possible, because they are full of guidance, they are full of prospects. They can now, they can see their future.
We want to see adolescent girls and young women live quality lives with equity, dignity, and opportunities to realize their full potential. Thank you.